Hello everyone, I'm Ömer from Diarrhea. Today we will be talking about 10 important signs that you need to go to vet. When you see any of these signs, please do not wait, do not ignore, and do not think that kitty will cure itself. Please go to clinic as soon as possible. You might be thinking that going to clinic might be stressful for your kitty, but this might be a life-death situation for your cat. Please bring it to clinic when you see any of these signs. Sudden change in appetite and water consumption, losing and gaining weight. You have a daily routine with your cat and you know how much your cat eats and drinks. If you notice that your cat wants to eat more, there might be several reasons. If you are medicating your cat, this may increase the appetite. Or weather change. In the colder days, your cat will want to eat more to be able to store more fat. And this behavior is instinctively. If your cat refusing to eat in several meals, or if your cat refusing its favorite food, I'm repeating, if your cat refusing to eat its favorite food, then the bells are ringing for you. Because cats will refuse to eat only when they don't feel well. If your cat likes to eat and it eats a lot and it becomes fatty, that's not a medical concern. But in a long term, your cat can become very fat, you might be facing obesity issues, and that's a medical concern. The most concerning part is your animal eating a lot and not gaining any weight, or it's actually losing weight. The most common causes, especially in older cats, are hyperthyroidism or diabetes. Another possibility is intestinal condition, in which food goes to the digestive tract, but nutrients are not absorbed properly. If your cat's starting to drink suddenly a lot of water, this might be a sign for kidney disease or diabetes. Not drinking enough water can also cause a lot of problem, especially for your senior cats. You shouldn't forget one important detail. If you're feeding your cat only with wet food, your cat may drink less water because it's taking liquid from the wet food, but still it needs to drink. Coughing or vomiting a lot, and coughing a lot with blood, or vomiting with blood. Coughing can be a sign for many things. After eating a cat grass or long grooming, your cat can throw up hairballs and it's completely healthy. If the cat starts coughing a lot and if it lasts more than a day, there might be many reasons, such as asthma, allergies, lung disease, and heart disease. Related to this, if your cat also having a heavy breathing or difficulty with the breathing and with the colored gums, you should see your vet immediately. The same story also goes with vomiting. Throwing up hairballs after grooming or eating a cat grass is completely normal and it's healthy. When your cat eats too much and too fast, it can also vomit. You will be seeing undigested food, but if this situation repeats too many times, you should see the vet, because your cat might be facing with a stomach, intestine, or digestion issue. However, if you notice your cat vomits too many times in a day and if it becomes with blood, you should inform your vet immediately, because your cat is facing with a serious problem. Very important one, when your cat can't urinate in the toilet. Cats who tries to urinate and can't produce urine, and because of it, it cries in pain when they go to the litter box, needs to go to vet as soon as possible, because this is a life-threatening emergency. This situation pops up most of the time with the male cats, but it doesn't mean it will not happen to female cats too. I recommend you to watch more if you have a male cat at home for this reason. If your kitty visiting the litter box over and over and if it can't urinate and if it overlicks the urination organ, time to go to vet. The possible reasons for it to happen can be bladder stones, infection, even cancer. Cats have also particular problem called lower urinary tract disease. This disease causing a heavy inflammation and cats cannot urinate. As you can imagine, this is completely painful and life-threatening. If your cat has one episode of diarrhea, you can wait and see will it improve or not. If it doesn't improve, and if it becomes worse, and if it becomes persistent and turns to be bloody, you need to visit vet immediately. Because of diarrhea and losing so much liquid, your cat can become dehydrated, and that can be life-threatening. There might be several possible reasons for that, such as bacteria, virus, coccidia, or intestinal worms, or non-infectious irritants such as stress, NIV medication, poisoning from a plant or a rotten food, change of a food which your cat not used to eat, food intolerance, or allergies to a specific ingredients of a diet can be a reason. Change in use of litter box. For out of no reason, if your cat suddenly stops using the litter box and poos and pees out of the box, this is a sign for you. Pooing and peeing out of the litter box not always a behavioral issue. It might be also health related. Your kitty might be telling you that I don't feel fine. It can indicate the urinary tract disease, bladder infection, or kidney disease. You should also clean the litter box regularly. We recommend you to clean every morning and every night. If you are not keeping the litter box clean, your cat can pee and poo also outside of the box. We recommend you to keep it clean. Heavy breathing and bad smelly breathing. If your cat is breathing heavily and noisily, but isn't too hot, stressed, or tired from exercise, their labored breath could be a sign of serious medical issue. If you see a cat breathing with an open mouth, which is unusual and not common, good to check it. It's a sign of a respiratory distress. You need to visit a vet. Cats are not like dogs, folks. A common cause is feline asthma. However, other conditions that involve respiratory tract, such as heart failure and lung parasite, can also cause change in respiratory pattern. There is nothing you can really do at home when your cat breathing heavily or having difficulty with breathing. You need to bring your kitty as soon as possible to veterinary. Unusually or noticeably, the bad breath can be also a sign of health problems. Most commonly, bad breath indicates the need for a good dental care and cleaning, and perhaps extraction due to dental disease. Additionally, bad breath can be a sign of a kidney disease. Having a seizure. Seizures are quite dangerous with cats, and it should be considered as an emergency. Signs for it: sudden collapse, loss of awareness, violent shaking of all four limbs, chewing or twitching of the face, and often salivation and urination out of control. One-time occurrence of a seizure on your cat may be caused by metabolic disturbance, head trauma, low blood sugar, severe fever, or toxic ingestion. Repeated seizures can be indication for epilepsy or other serious illnesses. While your cat is having a seizure, we don't recommend you to touch them unless they are at risk of hurting and endangering themselves. For example, falling from high to the ground or falling in a water. If you try to touch your cat while it's in seizure, you might be risking yourself with a serious scratch and bites. During the seizure, your kitty will be in a big stress and panic, and instantly it will try to protect itself, and it will not even know that it's hurting you. Unusual colored gums. You can examine your cats best when they are sleeping and calm with you. Good to check your cat mouth regularly for possible issues. Your cat's gum can reveal a lot about their health and oral care. Your cat's gum color should be pink when they are healthy. Different colors of gums can represent a different type of problem. It is important to inform your veterinary if your kitty has a different color of a gum besides pinkish. Cat walking abnormally or limping. The movements and the activities of your cat can tell you a lot about their health state. If your cat starting to move strangely, too slow, or not able to jump like it's used to, or if it is limping, there is several reasons for that. He or she might have arthritis, infection, or an injury which might be causing a pain. If you have a senior or super senior cats which are above 15 years old at home, less activity can be normal for them. but you should still check them regularly with vet visits. You find a new bump on your cat. It's important to be every bump or lump or anything unusual to be checked on your cat body. As they can range from simple bug bites to abscesses to cancerous growth. Some of them are fine to leave alone and to observe in time, and others needs to be removed surgically and biopsied to determine the treatment. If you see a bump or bumps or anything unusual which is not supposed to be on your cat body, we recommend you to inform your vet immediately. Thank you very much for watching the video. If you like our work and if you would like to support us, subscribe to the channel, like the video and share with your friends.